Good afternoon, everyone. I'm Allison McKay. I'm the chair of the Civil, Environmental, and Geodetic Engineering Department. It's my pleasure to once again welcome you to the CEGE CONNEXT Lunchtime Seminar Series. This program highlights creative and amazing research that's happening right now in the Civil, Environmental, and Geodetic Engineering Department. And the full realized value and impact of this work really occurs when research is informing practice and policy. So we've put together this series as an opportunity for you to hear from faculty as they share their perspective on recent innovations that are relevant to practitioners. So we're happy to reconnect with you today and to highlight that the CEGE department continues to be a resource for you after you graduate. Today, it's my pleasure to introduce Dr. Daniel Gingrich, assistant professor with an appointment in Civil, Environmental, and Geodetic Engineering that is joint with Integrated Systems Engineering. He brings expertise in decision science and operations research to evaluate and inform policy around infrastructure systems that provide critical societal services. Today, he will address the topic of drinking water affordability. I request that you please drop questions in the chat function at any time during the presentation. I will moderate those at the question and answer session at the end of Dr. Gingrich's presentation. And let us now welcome Dr. Gingrich.
All right, thank you, Allison, for that introduction. And I will go ahead and dive right in. As Allison mentioned, today I'm going to talk about water affordability. And in particular, think about the history of water affordability as a concept when it comes to drinking water services. In part because we're likely to see changes in how we assess and think about water provision and its affordability to low-income households in the future as the water regulatory landscape continues to change. And before I dive in, though, I want to start off with a brief high-level overview of what it is when I talk about this phrase, water affordability. And in particular, water affordability has many meanings if you dive into how it's used, whether in policy discussions, in academic literature, in everyday life. But really, it boils down to these two understandings. The first of which is the more common one, and this is the idea of household affordability. In essence, households have access to affordable water if they have the ability to pay for that water services and enough water to meet their everyday needs. This stands in contrast to the second understanding of water affordability, which is regulatory affordability. Regulatory affordability comes into play when we need to assess the ability of water utilities to provide clean and affordable services to their customers that are consistent with regulations promulgated by the Environmental Protection Agency or by other state bodies that might have authority to do so. In essence, this is going to boil down to the ability to purchase water versus the ability to provide water services. And for most of this talk, but not all of it, I'm going to focus in on the second understanding of water affordability, which is thinking about regulatory affordability. And that's in part because there are many stressors that are facing water utilities today. There is the fact that we haven't invested in our infrastructure, our water infrastructure, over the past decades the way that we have needed to. Much of our infrastructure is nearing the end of its useful life when it comes to conveying and treating water, or it has already exceeded its useful life and is causing serious consequences for the well-being of the American population. Estimates say that as of 2012, about $1 trillion is going to be needed in order to replace water and wastewater infrastructure systems that were built around the start of the modern regulatory enterprise for drinking water around World War II. In addition, water systems aren't going to just need to deal with the past and rebuild as we update and modernize our infrastructure, but think about a far more uncertain future when it comes to the consequences of climate change. Estimates say that in order to deal with drought, resiliency, impacts from things like flooding, is going to cost water systems on the order of $36 billion by 2050 in order to meet the challenges that a changing climate is likely to impose on them. Then there are questions around regulations and increasing activity around regulations on drinking water contamination. As of right now, there are over 90 contaminants that have primary national drinking water regulations or primary maximum contaminant levels. There are secondary MCLs, I'll talk about those a little bit later. but these are regulations that water utilities have to meet when it comes to the provision of drinking water services and drinking water systems. And this will have affordability consequences because water utilities will often need to charge their customer bases in order to pay back the capital that goes into developing the treatment systems required to meet these regulations, or to paying for the operating and maintenance costs for such treatment processes. And thinking about regulations and water affordability, while it dates back to the initial early congressional record and congressional debate around the 1974 Safe Water Act, it really becomes a regulatory push and something that utilities and the Environmental Protection Agency starts to think about in 1996 in the Safe Drinking Water Act amendments that were signed by President Bill Clinton, shown here. And so this is really the start of when the EPA was formally tasked with thinking about affordability and its consequences for customers and for the American population, and the consequences that regulations propose or might have on the ability of households to afford water services. And we can think about this relationship between water affordability and regulations like this. We have several groups in this simple model, the simple diagram I'm going to use to show you here. We have utilities whose job is to treat and distribute water to customers, and we have the households that have money to pay for that water provision services. In essence, households give money to utilities and utilities give households that water back. But this might change, and in particular, we can think about how utilities have to spend the money that they make. And oftentimes, the money that utilities bring in the form of revenue needs to go to pay for maintenance, operating costs, and system level improvements in order to continue to provide safe, reliable water sources to their consumers. This then gets shifted when the Environmental Protection Agency or another regulatory body comes along and promulgates a regulation. And in particular, we can think about this EPA regulation that is going to increase the cost or create more need for more improvements to the system, either in the form of capital costs or again in operating and maintenance changes. Now, the EPA is aware of this, and they're tasked by the 1996 Safe Drinking Water Act amendments to think about the ability of systems to raise money from their ratepayers. In essence, the amount of money that is left over that households can afford to spend on drinking water provision is what's known as the system's financial capacity. And in this model and this understanding, the system capacity can then be tapped in order to pay for the water improvements and to cover the increased costs that a regulation might impose on systems. This works up to a certain point. So for instance, we have one hypothetical regulation here, but we can think about a second hypothetical regulation that is also going to impose additional costs on water utilities, and those costs are going to need to be passed along to ratepayers. However, here we run into a scenario where we can compare the remaining system capacity in the water utility and the households that pay rates in order to cover these costs. And we can see that at a certain point, there will be this fundamental mismatch where the needs of the utility in order to comply with the regulation is not going to match up with the financial capacity of its ratepayers in order to afford and still maintain access to drinking water services. And this is what we think about and how we define the idea of unaffordable water. And so to assess this work, to think about this history of water affordability, I'm going to use the same general framework, or we've used the same general model. I'm going to provide a high-level introduction. I'm happy to take questions during the Q&A period. And we'll also be doing work and a little bit of work to talk about how we tailor in each case. But in general, we want to understand what is the financial capacity of systems? How much can they tap into without overburdening their consumers for water? And so to do this, we're going to collect data on 4 different sources. We're going to look at the demographics of systems. That is, what is the average household size? Because that will impact the average water bill per household. We're looking at data on water usage per household. And we're going to be looking at a variety of economic factors and economic metrics to understand the financial health and well-being of households that are ratepayers. In addition to that demographic data shown in the green box, we're also going to look at cost of water in the blue box. That will come from a variety of sources to understand what are the current water rates and the household water bills that consumers are paying for water services. We're going to look at the cost to comply with regulations using data and models developed by the EPA specifically for these purposes of understanding the economic consequences of regulation. And then we're going to look at a diversity of affordability thresholds or affordability metrics. in part because over the past 2.5 decades, as we've tried to nail down this nebulous concept of affordable water, there's been a bunch of different suggestions, both from the EPA as the people whose job it will be to implement such a metric, as well as the broader academic and water policy community. And in this particular talk, I'm going to highlight and think about 5 different affordability metrics. The first of these is what's known as the expenditure margin method. The basic concept is that we're going to take the household water bill after a regulation has been proposed and compare that to the community's median household income, or MHI. And if that ratio is above some critical threshold, then we will determine that water is unaffordable. For much of the history of the EPA's work on water affordability, this has been their standard approach. But there have been attempts to look at other ones, such as the incremental burden method, whereas the expenditure margin method thought about the entirety of a water bill that a consumer is paying. The incremental burden is going to focus on the consequences of one single regulation. And so we'll look at this in the context of the arsenic regulation that was promulgated in 2001. And we'll try to understand what is the incremental cost of just complying with an arsenic standard. But we're still going to do the same basic principle. We're going to look at this cost and compare it to community's median household income. And if it's above some threshold, then that will be unaffordable water. There are other metrics, though, that have come out in the recent years. Some of them include things like the hours of minimum wage, that is, the number of hours that a household or a worker would need to work at a minimum wage job in order to afford water provision for a month. There's the affordability ratio, which is the ratio of the household's water bill to disposable income, where disposable income we can think about as the household income minus all non-essential water costs, so minus things like rent, food, electricity, other forms of energy, transportation, healthcare costs. All of these things will be, once removed, will give us a disposable income, and we can understand how much of that disposable income needs to be spent to think about water. And then there's the residual income approach, which is to think about how are we going to assess the money that is left over. So rather than thinking about a ratio, just think in absolute terms. And so as we think about the history of affordability for drinking water services and the future potential for drinking water affordability in a changing regulatory landscape, we're going to look at these 5 metrics. And for the rest of the talk, though, I'm going to walk through some history. In particular, as I've already hinted, we're going to look at the past, the present, and the future of water affordability services. The past will be a look at the first test for water affordability, and that was the arsenic maximum contaminant limit that was promulgated in 2001. Then we'll look at the present and try to understand what does household water affordability look like today, in particular in a post-COVID world. And then finally, we'll look at the future of water affordability and try to understand how future regulations on perfluoroalkylated substances, or PFAS, or what are colloquially known as the forever chemicals, what complying with EPA standards around them might do for household water affordability and the ability of systems to pay for those regulatory challenges. So with that, I'm going to dive into the first one, and that is the affordability of the arsenic regulation. And we're going to start off by thinking about the first drinking water regulations passed under the Safe Drinking Water Act. Here we see Gerald Ford signing the Safe Drinking Water Act after it was passed by Congress. Following the signing of the Safe Drinking Water Act and its passage, the Environmental Protection Agency, as an initial cut, just permanently adopted, or adopted on an interim basis, the various drinking water standards that were implemented before that by the US Public Health Service. In the case of arsenic, that included a 50 parts per billion standard. The EPA promised they would get around to setting a permanent standard. However, it took a while and a few lawsuits in order to incentivize them to actually get to that work, in part because of the tricky nature of arsenic regulation and arsenic removal. And it's not until 1996 and the Safe Drinking Water Act amendments that we see Congress telling the EPA, no, you really need to do something about arsenic in our drinking water systems. And so what we see is that in the last days of the Clinton administration, literally the last 2 or 3 days, we see the EPA finally implementing a standard for drinking water regulations. However, that standard of 10 parts per billion lasted only a few months when the Bush administration used administrative law in order to temporarily kill that regulation. In essence, we can read the words of the EPA administrator at the time, who was talking about the costs that arsenic was likely to impose. In essence, Administrator Whitman talked about how if the federal government is going to impose costs on communities, especially small communities, we should be sure that the facts and the science are going to support setting a standard like that. And the focus on small communities is a really important when we think about water costs and affordability. In part, that's because smaller communities simply don't have the economies of scale that larger water systems are likely to be able to have in order to reduce the average cost of compliance, so the average cost of water treatment. And so when we think about affordability, there's a lot of attention that gets paid to small and very small systems. Those are systems that serve less than 3,300 people. And however, as you might expect, removing arsenic regulations from drinking water was not a politically popular move. And so we also see headlines like this that indicate a debate swelling over arsenic in drinking water supplies. This particular article focuses on a homeowner, Claire Whitbeck, who lived in Maryland. And it quotes her as saying, the question is, how much of this garbage are you willing to tolerate? How much arsenic in your water are you willing to accept? And she summarized the approach, at least in her perspective, of the Bush administration of, well, we don't know how much of this stuff is dangerous. And so we're just going to let it go. The Bush administration, as part of their work to understand the MCLs for arsenic, was really trying to understand the health consequences. Eventually, they did receive additional information from the National Research Council, the NRC, and they made a U-turn on the arsenic rule. We see that they reimposed the 10 parts per billion level that was implemented under the Clinton administration. And in part, we can see people who were instrumental in getting an arsenic MCL in the book, like this lawyer from the National Resources Defense Council, or NRDC, that said it's clear that the handwriting was on the wall, that the EPA could not adopt a weaker standard than the Clinton standard. And so in 2001, in the fall, we see the standard come back into play. But that was not the end of thinking and debating arsenic. In particular, the arsenic standard, there was a 5-year period for utilities to come into compliance. And even after this period, the Environmental Protection Agency was again tasked by Congress to think about water affordability for small systems. And so what we've decided to do, in some of the work I'm about to show you, is to take a look at several of the methods that the EPA was considering as a result of these changes, and try to understand how would they have performed under the arsenic regulation. Would they have come to a different conclusion than what the EPA found in their initial analysis, which was that the arsenic regulation was likely to be affordable for all systems? And to do so, I'm going to quickly look at 8 different methods that the EPA looked at for determining water affordability. These methods are going to differ on 3 different dimensions. There's methods, the percent of income, and we're going to look at $2,000. We're using data from when this regulation was promulgated in order to do some more accurate historic analysis. The methods themselves, there's going to be 2 of them. There's the expenditure margin and the incremental methods. Those are methods that both look at the cost of the regulation in the case of the incremental standard, and the cost of the regulation plus the drinking water, existing drinking water costs in the expenditure margin method. These are then compared to some percent of an income standard. There are various levels for the incremental methods. These are between 0.25 and 0.75% of the household's income. Whereas for the expenditure margin method, we're going to keep the 2.5% standard the EPA was using at the time. And then there's the income in 2000. And in particular, we're going to look at 2 different levels. We're going to look at the median household income, so understanding the system capacity. We're also going to start to look at low-income households, and how those are likely to behave or likely to perform under these standards. To do this analysis, not just so we can need this economic data around what household income was like in 2000, we're also going to need costs for drinking water treatment and compliance with arsenic. And as part of their work to understand how to bring down the cost of arsenic treatment, the EPA, its Office of Research and Development, set into place 50 different projects to understand the performance of a suite of technologies for drinking water for arsenic control. They looked at 50 different sites, 10 of which were for non-community water systems. And we wanted to focus on community water systems. So we've got 40 different sites that we're looking at as sources of cost data. And what we want to understand is, given these costs for arsenic compliance in these 40 communities, what is the likelihood that they would have been found to be affordable for the arsenic standard? And what we found is that under different approaches, some locations would experience unaffordable treatment. And this map here is showing those systems that would have been determined to be unaffordable, given what the economic conditions were on the ground. And so we can see that there's a diversity of these. We can also just look and think not just at the site level, but start to think also about the system level data and system across the entire country. And if we go back to this particular table showing our methods for determining affordability, I've got this new column on the right that talks about unaffordable system size. These are systems below a certain threshold would be determined to have unaffordable water. And so what we see is that for the standard the EPA used, which was method number 7, the expenditure margin with 2.5% of the median household income, it would turn out, as the EPA found, that all systems would be affordable. But we can change that around by looking at some of these other methods. So for instance, if we looked not just at the median household income, but the first quartile household income using the expenditure margin, or with the 0.75% of the median household in the incremental standard, we see that the smallest systems, those systems that serve less than 100 people, are likely to have water that was unaffordable under the standard. We can then change these thresholds a bit more. So for instance, looking at those lower thresholds with the median household income, or looking at some of the first quartile income with incremental burden. And we see that all very small systems, all systems serving less than 500 people, would likely to have been determined to be unaffordable under the arsenic maximum contaminant level that the EPA set. And then finally, at the most strict affordability definition, this one that is the incremental standard at 0.25% of the first quartile household income in a community, we'd see that any small system, so any system serving less than 3,300 people, would be unaffordable. And so some of the lessons, there's some implications that can come out of this and how we think about policy and how we think about water affordability, especially with this idea of an incremental method and not just the expenditure margin method that the EPA had adopted. In essence, the key takeaway is that under an incremental burden approach, which was the method the EPA was considering as a result of the arsenic MCL process, it would have been more likely that that standard would have triggered a determination of unaffordable. But there are some fundamental challenges with an incremental method that we haven't really acknowledged or addressed. The first of these is that an incremental burden approach is going to fail to account for what might be considered a stacking up problem. That is, if I have regulation 1 that imposes cost of 0.5%, regulation 2 is another 0.5%, 3, 4, 5, all of which might be 0.5%. I'm suddenly at 2.5% of my median household income for a total cost or a total percent of income. And that, if it's allowed to continue, will cause eventually problems no matter what threshold you set as a total water burden. So there's no overall cap that gets set under an incremental burden approach. It's also the case that any use of the median household income is not going to focus or think about the needs of low-income households, which is critical for understanding household affordability. And so really what we need to think about is not just median household incomes and system capacity, but thinking more broadly about all of our community of ratepayers, not just those that are the median household. Which brings me from this first story, the story from the early 2000s that and the following decade and a half of work on arsenic, to think about what's really taken over the discussion in water affordability since then, which is understanding low-income households and their ability to afford water services. And in particular, this came to a head during the COVID-19 pandemic, in part because water utilities across the nation imposed moratoria on water shutoffs. That is, we don't care if you can't pay your water bills right now. We're going to keep giving you access to drinking water, in part because we recognize that drinking water is an important part of what it means to be healthy, and it is an important part in maintaining your health and safety during a pandemic, where one of the pieces of guidance is doing things like washing your hands. And while that sounds trivial, there's scientific evidence that has found that there's likely to be a correlation between states and municipalities that had moratoria on water shutoffs during the pandemic and saving lives. In particular, there's estimates that upwards of about 9,000 lives were saved in the initial outbreak of COVID-19. that could be explained by the presence of a moratoria on water shutoffs in locations. And so we see that there is, in fact, this connection. But as the COVID-19 crisis, as the initial peak passed, we see communities that then moved to resume water shutoffs and water disconnections. In particular, we have one in Columbus. The moratoria ended on August 23rd of 2021, so roughly a year and a half after it was implemented. And households were expected to pay for water services again. And if they did not, there would be disconnections. There'd be consequences and loss of ability for water use. And so one of the questions we've been thinking about is, well, what is the current state of water affordability? And to answer this question, we partnered with the Ohio Environmental Protection Agency to conduct a survey on water, sewer, and storm sewer rates throughout the entire state of Ohio. We're going to talk about our work thinking about water, but that report is available on the Ohio EPA's website, or I can send it to you if you're curious, to understand what are water rates throughout the state. And this is what that distribution looks like. We see that there are, on the low end, communities that on average are paying less than $200 over the course of a year, all the way to those systems that are paying upwards of $1,200 over the course of a year for drinking water services. And so with water rates, before any regulations, we can now think about these various affordability metrics that I laid out, beginning around how do we define and think about water affordability. So again, that can be just the percent of household income that gets spent on water bills. We can think about the amount that's left over after your essential purchases. And we can think about the number of hours of minimum wage work that you might have to work in order to afford your monthly water bill. And what we find by looking at these different metrics is that median households are unlikely to be currently overburdened by water. So what I'm showing you here in this graph on the top left, the blue one, this is a cumulative distribution function of household income that gets spent on water bills. So you can look and see if you have a particular threshold in mind. In this case, we've highlighted that 2.5% threshold that the EPA established. And you can look and see what percent of systems are above that or below a particular threshold. And so looking at these numbers, what we see is that there are no households or no communities in the state of Ohio in our survey where the median household income is 2.5% of the median household income is less than what households pay. So in general, median households appear to be able to afford water. That's not the case, though, if we think about some of these other metrics that are more geared towards low-income households and low-income populations, like our affordability ratio and the water cost, or the hours of minimum wage that need to be worked in order to afford water. In these cases, we see that about 40 to 50% of communities or water systems in our survey have water bills that might not be affordable for their low-income consumers. And so when we look at these low-income numbers, we see a story around how even if systems might be able to afford water provision and the median household might be able to pay their water bill, that's not the case for low-income households. I also separated out, and what I'm going to show last, the residual income, in part because it's graphed a bit differently, whereas for the first three graphs, you don't want to have systems to the right of that dashed line indicating our threshold. For the residual income before treatment, you don't want to be to the left of that dashed line. That dashed line represents the poverty line. And so if you are below that line, if you're beyond that line on the left, it indicates that water services are driving a household into poverty. And it's something that we generally would like to avoid and not see. And so this really drives home the point that if we think about median households, they're fine. They are able to afford their water services. It's the low-income households that aren't able to. I do want to acknowledge that there are, in many places, programs and policies in place to help low-income households afford water services, whether it's things like essential lifelines or certain financial support for water. However, those programs are vastly underutilized and not known about sufficiently. And so there's a real need to think about how we better publicize and advertise these programs so that households can afford basic water services. Because if you can't afford basic water services, then households get put in really awkward, uncomfortable trade-offs that they have to make between other essentials. It comes down to, do I pay this month's water bill or this month's electricity bill or a medical bill to get my prescription for my drugs? Or do I get less food and experience food poverty as a result of these water bills. Households have really difficult trade-offs to face when they're unable to afford water. And so research and evidence like this is really important to understand and think about, what does this look like in our state right now? One of the things I've also hinted at and talked about it a bit more with arsenic when I was quoting Administrator Whitman, was thinking about small systems and smaller populations. Again, they have smaller customer bases and they have smaller ability to tap into economies of scale, which means that their water costs tend to be higher per gallon of water treated or produced as a result. And so oftentimes when we think about water affordability, we're thinking about smaller communities as a result, because that's where you're not going to have the population base to support those larger systems that can be more efficient. However, if we break these data down and don't just look at different types of metrics or present them all at once in a grouped diagram like we've done here, but look at it by system size, we see that for many of these metrics, there's still going to be consistent numbers of households, or consistent percents of households in very small up to large, and in some cases, and for some metrics focused on disposable income for low-income households, even very large systems, where there's going to be significant populations that are unable to afford water services or will have unaffordable water. We see that this is consistent across. And so system size might not necessarily be the protection that we need from keeping systems from having smaller water bills and water bills that are more affordable for all of their ratepayers. But that's where affordability stands now, is that low-income households are likely to be stressed and experience water unaffordability, even as median households from all systems, or at least most systems, are likely to be fine. Which brings me to the future of water affordability and thinking about regulations that are coming down the pipeline and how those regulations and the compliance costs associated with them are likely to be a problem. In particular, I'm going to focus in on PFAS compounds, the perfluoroalkylated substances that I mentioned earlier, such as that found in firefighting foam shown in this picture, and what compliance with this might do with household capacity and system capacity to tap in and pay for water services. And over the past few years, we've seen a flurry of scientific and regulatory activity to understand PFAS compounds. And under the regulations, there are several requirements that need to be met for the EPA to promulgate a regulation on drinking water. First, the contaminant needs to be widespread throughout the nation. If it's not found in multiple states or multiple regions, then the EPA is likely to, instead of it taking action, recommend that various state-level departments of environmental protection or environmental quality or health departments take action on their own, rather than getting the federal government involved in what is a regional problem. If it is widespread, then there has to be human health consequences as a result of that contaminant being present in order to justify regulation and justify the costs. These ones that have human health consequences are known as primary standards. There are, in the drinking water community, secondary standards. Those are standards that are primarily focused on contaminants that either have aesthetic consequences for water, so things like discoloration of water or taste and odor compounds. They can have cosmetic impacts for people that drink them. So for instance, there's a standard on silver that has never been a threshold of concern in the United States, but it exists because there's evidence that high levels of silver in water might lead to skin discoloration for humans that consume it, but it is purely a cosmetic change. It has no deleterious health consequences besides that. And then there are technical constraints around it, thinking around things like hardness, so scale buildup, damage to equipment, either in industrial applications with homes, so glass etching, things like dissolved solids might also be relevant here for that. But for primary regulations, which we're going to focus on, it has to have a human health consequence. Once a human health consequence has been demonstrated, there also needs to be evidence that there are technologies that are suitable for this regulation. That is, that there's technologies both to treat that contaminant down to a regulatory level of interest, but also that there's the capacity to monitor and analyze water samples to ensure that we are able to meet our regulatory level. And once we know that there's these technologies, we need to ensure that such technologies can be operated in a cost-effective manner and that they do not pose an undue and unjustified financial burden on communities. That unjustified implies a benefit cost analysis standard has been the rule for most environmental regulations promulgated by the federal government since the Reagan administration in the early 1980s with an executive order that he first promulgated. So for PFAS, we are seeing evidence that these boxes are being checked. So for instance, there's been work by scientists throughout the nation, and in particular, there was some work recently by scientists at the United States Geological Survey that found that PFAS contamination is present in 45% of drinking water supplies throughout the entire country. So nearly half of all drinking water utilities likely have some PFAS contamination. So it is a widespread concern. We also know, and there's a growing and continuing to grow body of evidence highlighting human health consequences for PFAS contamination throughout the entire human life cycle around PFAS and what it can do to us. Everything from birth weights all the way to increased risk of death and cardiovascular disease. And so there's a pretty solid body of scientific evidence linking PFAS contamination to human health consequences. So that ticks the second box. There's also a growing effort to think about the technologies that exist to remove PFAS compounds from drinking water. And in particular, when we think about PFAS, there's what are known as the big three. These are reverse osmosis membranes, which essentially filter out PFAS compounds. They can't pass through a membrane. Then there are sorptive materials like activated carbon and ion exchange, both of which are going to allow the PFAS compounds to essentially sorb to the surface or stick to the surface of these resins or these activated carbons with treated water coming out the other end. And so we have technologies that exist. We're also developing and continuing to develop technologies that can allow us to detect PFAS compounds at even smaller levels. So we're getting to the levels of interest for drinking water for PFAS. And so we've checked 3 of these boxes, and as part of their effort to understand this last one and to promulgate a regulation, which the EPA has announced a preliminary PFAS standard, an intent to regulate, an intent and some initial thoughts about what that standard will be. That was promulgated a little under a year ago in March of 2023. We're going to need to start to think about how water systems will comply with PFAS, especially given that those big 3 technologies can be very expensive systems to install and operate, especially things like reverse osmosis, and that there are associated costs, not just with the treatment itself, but thinking about residual disposal and what we do with this PFAS once we've got it in a more concentrated form. And so what we did here was to think about what are the technologies that we can consider. We included, at least for smaller systems, not just the big 3, but some other options that the EPA has models for, but aren't really considering around non-treatment, essentially building or drilling a new well for a system, or doing an interconnection and connecting with a bigger nearby system. And we use these EPA models to understand for systems, what is the lowest cost technology that a system of a particular size is likely to adopt. Because once we know what technology systems are likely to adopt, we can then add that cost of compliance onto those previous estimates that I showed you of drinking water affordability. And so here's what those updated distribution functions look like. We see that now, whereas previously, even for things like those standards focused on median household income, like the expenditure margin method, the top left, the blue graph, we see that there are systems that are now starting to have unaffordable water as a result of compliance, even for their median customers, which is interesting and concerning. Because that then means that the standards for low-income communities and how we think about low-income households' ability to afford water will be exacerbated. And that is indeed what we find is that, I'll show you on a couple slides what the percent change, but we're looking at the order of anywhere between 5 and 20% of systems are now, as a result of PFAS, more likely to have unaffordable water for their low-income communities. And so we see that compliance with this standard is likely to be a challenge. There is money available to help utilities install treatment technologies. There's a bunch of this money as part of the bipartisan infrastructure law. However, there's a lot of concern, not just around the building of the new technology, but also how it will be operated and how it will cover those day-to-day operating costs for water utilities, because there's a lot less money to support and subsidize daily operations of water infrastructure systems. And that's really where the costs and concerns might then come into play when we think about water affordability for PFAS compliance. We can also, again, not just look and think about this for all systems or systems as a whole, but we can break this down by system size. And here I'm showing you the affordability ratio approach. And we see here that it's not just the very small systems, those systems in blue and purple on the top row, but even those that are medium and large systems. So those systems that serve more than 3,300 people are likely to start to run into issues with water affordability as a result of complying with the perfluoroalkylated substances regulations. And so we can also keep this in mind, and we can look and see how this is going to change. There is, though, whereas before, when we were just looking at overall water affordability, it was a relatively consistent distribution of systems that were likely to have unaffordable water across system size categories. That's not what we see with PFAS. Here we really see a difference between some of the very smaller systems that would likely need to comply with regulations, all the way to the large systems. And we see that there's a spike around the very small for some of these metrics, indicating that they will in fact have higher likelihoods or a marginal impact or marginal effect compared to larger systems. We can also see that, though, when we compare the percent of systems that are likely to be unaffordable when it comes to thinking about low-income households. So here on this graph, what I'm showing you is the difference between the number of systems or the percent of systems that were deemed unaffordable under the different metrics and the different size classes, and what under a PFAS regulation and under the existing standard, the existing baseline right now before a PFAS regulation is imposed. So that means that, for instance, 21.74% of very small systems did not have unaffordable water per the hours of minimum wage standard before PFAS, whereas after PFAS, we're seeing an additional 21.74% systems. So 1 in 5 systems are now likely, of the very smallest, to have water that is going to be unaffordable given the hours of minimum wage standard that we have. And so we can see with this in mind that the very smallest systems are likely to have substantial impacts. Although there's an interesting peak around the medium systems as well, where we're seeing upwards of 10 to 15% of water systems are likely to have unaffordable water. And so with that, to quickly wrap up, what we see is evidence that many utilities, by looking at that median household income metric, as well as the residual income approach metric, utilities may indeed have financial capacity to afford water systems. The median measures, those measures of the median household, are good proxies for what is the ability of a system. Given that is the median household, there's some houses that are less, some houses that are more, but as a measure of the pool of resources, it's a pretty good measure. But that's not necessarily the case when we look at low-income households, that is the hours of minimum wage and our affordability ratio measures. Where in these cases, what we see is that these households already struggle with water, and they're likely to continue to struggle with water even more under a PFAS standard. This is also true across all system sizes and not just very small systems. And it's, again, those small and very small systems that tend to receive a lot of attention when we think about water affordability and water policy as a result of affordability challenges. So that is the near future for water affordability, is thinking about compliant challenges with perfluoroalkylated substances. So together that kind of tells this tale of the past, present, and future of drinking water systems and drinking water affordability. There's some other stuff, some other broader things that we're thinking around water affordability and ways really to make water more affordable for low-income households. And one of the things that we're really thinking about is rate structures. In particular, how do we design rate structures so that there's some level of cross-subsidization in low water use households? I'm going to try not to get too into the weeds here around water rate structures, but I want to do a little bit. There are several different ways that water utilities can set their rates. One of which is known as a uniform block without a fixed component. That is, every 1,000 gallons or every 100 cubic feet of water costs a household the same amount. That is, you might pay, for instance, 20 or 15 bucks for a kilogallon of water, no matter how many kilogallons of water you end up purchasing. In which case, the average price of water is going to look the same because you're paying the same per gallon of water. This is different when we compare to other forms of structures, such as, say, an increasing block structure, where the more water you use, those higher uses of water, those last few gallons of water will cost more than those first few gallons. And what this allows us to do is it shifts the average for high water use households up so that they're paying more, whereas low water use households are paying less than the system average. And we can think about how we design these policies to cross-subsidize, such that that higher water use bill that these higher water use households are paying can be used to subsidize lower water use household bills. And it would allow us to do so in a way that is revenue neutral. It's also important to understand that this kind of rate design structure follows economic logic in general. Economic theory tells us that the more of something you should buy, those last few units should cost more than those initial units in order to ensure that you are properly using the resource that you're getting and that you are internalizing consequences and thinking about its use appropriately. So such an approach is consistent with economic logic. However, this is not necessarily what we find when we ask systems how they structure their rates. So this is some data, again, from that Ohio water and sewer rate survey, where we just asked utilities, how do you structure your rates? And what we see is that smaller systems are more likely to report having uniform or single block structures. They are more likely to have those first measures that just have everyone paying roughly the same amount per gallon, as opposed to the large and very large systems, which are those that are more likely to have variable block rates. That is, something like an increasing block rate structure that I showed you on the last slide, or a decreasing block rate structure where those last few gallons of water cost less per gallon than those initial gallons that a household might purchase. What we also see is that when systems report having a variable block rate, especially large and very large systems, they're more likely to report having decreasing blocks, which means that rather than seeing the cross-subsidization of those higher water use households paying more per gallon, which can be used to subsidize lower income household water use, we see the exact opposite. We see that lower water use households may be more likely to pay more per gallon than high water use households, which is interesting. In part, again, it is not the way that economic logic would teach us to think about water resource allocation questions, but it also raises really interesting and challenging equity concerns. We think about how we design water rate structures that will be equitable, that will ensure that individuals have access to water services at costs that are not an undue burden to households, that will not force them into uncomfortable trade-offs between other essential services like electricity, food, transportation, clothing, medical care, because that's really what we want to avoid. The goal of water service and the goal of water provision is to protect public health. At the end of the day, that's what drives this work. Is we know that if people have access to health, to clean water, they're more likely to be healthy, and there's a public benefit in that. But what we can see if we're not careful in how we think about these rate structures, that we will not observe that we might instead see that water, rather than being a public benefit, is imposing public costs because people are not able to afford their essential services. And that might have consequences for those individuals that we as a society will then be asked to bear as part of our healthcare policies. But with that, I will now open the floor up to questions.
Thank you, Daniel. So I invite participants to put questions in the chat, or also I think with the size of the group we have today, if you wish to use the raise hand function, we can get those questions to Daniel. Well, let me start with a question, Daniel. Has your work or other people's work looked at the trade-off between regulatory cost and impact and then resulting health impacts. It seems sometimes there can be a disconnect in this space, and I'm thinking particularly about the impacts of particulate matter and air pollution regulations.
Mhm. So there has not been, to the best of my knowledge, no one has really looked at the health trade-offs that get forced when we think about regulatory costs, especially at the household level. That is an area I'm interested in thinking about, how we actually get into household budgeting and decision-making, and therefore thinking about risk budgets for households and risk budgets for utilities, as we try to optimize regulations across the federal government in ways that seek to reduce risk. But to the best of my knowledge, is not one that takes into account cost and really opportunity costs and regulatory compliance.
And has that been examined at the societal level?
So there were some attempts to obliquely look at that in the 1980s and 1990s. There was a flurry of activity in the administrative policy and benefit cost analysis space to understand what is the de facto value of a risk reduction activity. In essence, how many deaths, how many statistical fatalities, without getting too into the weeds on what a statistical fatality is, are saved per investment. So there's work to understand for like 500 investments or 500 regulations. This particular regulation cost this much, this particular regulation cost this much and saved this many lives, and therefore dollars per life saved. We're calculating, try to understand what does this look like across the entire suite of regulations, and then how do we balance that to make sure that we're putting money in regulations that have higher returns on investment, so that these ones are justified, whereas some of the workplace safety ones they like to highlight had order of billions of dollars per statistical life saved, which is well above what the current threshold is and current guidance is. So there's some effort at the society level to think about that, though.
Thank you. I'll make another call for questions from our participants today. If there's not additional questions, I do want to thank Dr. Gingrich for a really informative presentation that wove together the societal, economic, and technology factors that make these types of regulations important to implement and consider carefully, but also to highlight the complexity and how to approach some of these questions. So I do appreciate your contribution today. And I would like to thank everyone for joining us on the call today. Our next event is going to be April the 3rd, again at lunchtime, and Dr. Khalil Sazen will present, and this will be a presentation that's really focused on structure systems. So I hope that you will all join us again then. Thank you.